Okay, so we're going to talk about antibiotic resistant bacteria. So, trillions of bacteria are known to exist, and fewer than 100 of them cause bacterial infections in the body. These infections range from mild to potentially lethal and require treatment with antibiotics. But some bacteria genetically mutate and become stronger than the antibiotic that once treated, causing a resistance. The Center for Disease Control and Prevention, along with the World Health Organization, closely track antibiotic resistant bacteria and advise on policies and guidelines to aid in the fight. These groups monitor the healthcare settings, agricultural sectors, the community and the environment, infections, and the effects of antibiotic resistance within these demographics. This rising issue leads to higher medical costs due to longer hospitalizations, use of more toxic antibiotics, which in turn harm the body and even affect animals and the environment. Individuals, healthcare providers, and policymakers, along with the agricultural sector, can all help to battle the increase in antibiotic resistance. So there are a number of known antibiotic resistant bacteria, and the cases have grown and they now pose a health threat globally. The CDC state that more than 2.8 million antibiotic resistant infections occur in the U.S. each year, and more than 35,000 people die because of these infections. Antimicrobial resistance is an urgent global public health threat, killing at least 1.27 million people worldwide and associated with 5 million deaths in 2019 alone. People that have pre-existing conditions, receiving kidney dialysis, organ transplant patients, recipients undergoing chemotherapy, and even surgical patients are at a much higher risk. The effects on these patients include more serious illness, longer hospitalizations, and higher medical costs. While this group of people are the most susceptible to contracting a bacterial infection due to an already weakened immune system, anyone can contract an antibiotic-resistant bacterium through contact. A growing number of infections such as pneumonia, tuberculosis, gonorrhea are becoming harder to treat as the antibiotics used to treat them become less effective. Proper testing of bacteria through an antibiotic susceptibility test to ensure the right antibiotic is being consumed is costly and time-consuming, and providers often prescribe antibiotics without first testing for which bacteria is actually causing the infection. Use of antibiotics in the healthcare setting is not the only way that resistance has grown. The agricultural sector has also played a part. Agricultural use of antibiotics have increased bacterial resistance. Antibiotics are used to treat bacteria in animals, and this practice is encouraged with the guidance set forth by the FDA and the USDA, since animals, much like humans, carry bacteria naturally in their gut, which may include antibiotic-resistant bacteria. This resistant bacteria can also be present in water or soil contamination through animal waste and can be found on fruit, vegetables, and other produce. Antibiotics used for speeding up growth in food-producing animals that we get food from, is an example of inappropriate use of antibiotics and has contributed to the spread of resistance. This practice has allowed bacteria exposure at a low dose of the bacteria over time. As healthcare settings and the agricultural sectors continue to make changes to help slow the growth of antibiotic-resistant bacteria, individuals can also help. Bacteria spread not only from person to person, but also person to pet. If prescribed an antibiotic for a bacterial infection, you should follow the directions and complete the antibiotic as prescribed. When not doing so, you're contributing to bacteria having the ability to evolve even further and become resistant to these antibiotics. Hand washing, as always, is the number one way to prevent the spread of infections. The CDC also points out that waste from people in hospitals and animals on farms Applying antibiotics as pesticides and antibiotic manufacturing, which more commonly occurs outside the US, can also result in antibiotics and resistant germs in the environment. As the CDC and the World Health Organization continue to monitor the antibiotic resistant bacteria crisis and discover new ways to tackle this enemy, policymakers and healthcare providers are also required to adjust as see fit. Making stronger policies for infection control and prevention, regulating appropriate disposal of medications, and improving monitoring of antibiotic resistant infections are some of the way policymakers can help. Considering that travel is much easier and more frequent than it was years ago, antibiotic resistance is a global issue. Implementing and teaching proper hygiene practices are encouraged among healthcare providers and individuals. Even though there are some new antibiotics in the development, none of them are expected to be effective against the most dangerous forms of antibiotic resistant bacteria. And the strength of the antibiotics that would be necessary to eradicate these resistant bacteria would be too dangerous for human consumption.